Hi, everybody. This is Dr. Brett Talley, Daniel, MD, and this is going to be my 7th podcast on migraine. And today I want to talk about the lifestyle treatment for migraine. So our lifestyle, the way we live, is very important for any health problems, and it's something that everyone with migraine should do, and it's recommended that all these ideas be followed by patients with migraine or cluster-type headaches. The first item here is caffeine. So caffeine is considered an addictive drug. And the advice I would give for persons with migraine to decaffeinate themselves either slowly or by decreasing 1 cup of coffee or 2 colas every 3 or 4 days, or you can do it quickly, cold turkey, in which time you may have caffeine withdrawal syndrome with fatigue that may last several weeks, or headache. The reason for this is that caffeine is a vasoconstrictor, and it can give medication-induced headache if you take too much of it. Caffeine is the number one drug in America that causes an increase in the intensity and frequency of migraine, and it is addictive. Caffeine is confusing to patients because they know that it can be used for acute therapy. The guy who invented Coca-Cola was using it as acute onset, but then Dr. Pepper, with their logo badge on the front of the Dr. Pepper bottle, says 10, 2, and 4. So the guy who invented that addicted people, taking it 3 times a day. So caffeine's an addictive drug. And what it'll do is it can treat acutely headache if you have 1 or 2 a week. If you take that every day, like a large dose of caffeine or 3 or 4 Cokes or Dr. Peppers, it can aggravate or cause medication-overuse headache. And that used to be called rebound headache. Number 2, you should eat right. Eat 3 meals a day. A small breakfast will suffice. For example, a single sweet roll, a piece of toast, or some fruit with juice. Remember, breakfast means that you break the fasting of sleep. Breakfast. If you don't eat without your knowing it, your pituitary gland will sense your low blood sugar and send out a hormonal signal that will cause vasodilatation of your cerebral arteries and start your hungry headache migraine. 3 meals a day is advised for all medically accepted weight loss programs, such as Jenny Craig and Weight Watchers. And most mothers will feed their children 3 meals a day, but they will do it themselves. And I cannot tell you how many patients I've seen, usually feminine, in my office, who had headaches and only ate 1 or 2 meals a day. Number 3 has to do with exercise. The American Heart Association recommends that all persons exercise aerobically 20 to 30 minutes 3 or 4 times a week. And aerobic exercise means that you do an activity that gets your heart rate at a certain desired target range and keeps it there for the entire workout. Now, you can consult tables for this, for your heart range that's supposed to be in your age, and you can find these at bookstores, online, at the YMCA or your local fitness center. Some machines like Steppers will have it written on it. You can find the guidelines there. Now, the more aerobic the exercise within heart rate limits for age, the better it is. And you can treat migraine as exercise becomes a drug. You can treat migraine, anxiety, panic disorder, depression, tension-type headache, and sleep problems with aerobic exercise. And there are hundreds of scientific articles over the past 20 years proving that exercise works for headache therapy. Now, aerobic exercise is dance aerobics, like Jane Fonda, dancing, jogging, cycling, swimming, rowing, cross-country skiing, and stair-stepping. It is not walking, lifting weights, stretching, or playing most games, like tennis or racquetball, because it doesn't bring your heart rate up steadily for some time. If you're already exercising and still have bad headaches, consider increasing your exercise program. Exercise is something you can do for yourself to take control of your headaches. It takes determination, time, and effort. Some migraine headaches get what's called a workout headache if they get hot. If this happens to you, then try to work out so you don't get so hot. So exercise in front of a fan or an air conditioning. You could take a couple of days a week, but not every day, not all the time. A little bit of ibuprofen, etc., or half of a triptan drug before your workout, and it may help you. If you get still a workout headache, you can try swimming, which keeps your body core temperature the same. The next item has to do with setting your sleep-wake cycle to get up and go to bed same time every day, even through the weekend. I know that's hard, but it should be followed. Human beings have a pineal gland in their brain, like a little clock or computer that sets your sleep-wake cycle. So adults should sleep between 7 to 8 hours every night, and migraine can be treated by sleep restriction. So avoid oversleeping on Saturday morning or falling asleep for that seductive 2-hour nap on Sunday afternoon, and consider just how dopey and drugged and listless and fatigued you feel when you wake up from that 2-hour nap. Set an alarm for a 10 to 15, 20-minute short energy-restoring nap. If you've never learned how to do that, then learn it. It can be done. You can learn how to nap. The next subject area has to do with stress. So I want you to try to distress your life. Talk over your daily life problems with your friends, family, preacher, priest, or rabbi. Praise God about it. See if you can get help that way. Develop a support system to sustain you in life, built up of key people that are there for you when you need them. I always thought one of the things we should learn in families and growing up in grade school and high school is to do just that. Get a support system of people who are there for you can talk to. Plan time to relax and spend on hobbies or interests. Normal people have hobbies, which is something you do for fun and relaxation that is creative and not goal or money-making oriented. Children and family are not hobbies. Please look up the word hobby in the dictionary if you think that. Turn off your cell phone, computer, or iPad and get a life. Get a life. Plan 3-day weekends 4 or 5 times a year rather than 1-2 week holiday in August. Leave that depressing, stressful job or get counseling and try to change a personal relationship that is causing problems. The last comment has to do in general with not overtreat. So don't take too much caffeine, over-the-counter drugs, triptans, or painkillers for headache. In general, all migraine patients should limit all such drugs to no more than 2 days a week. That's the max. The migraine process generates neurochemicals which are released in the brain that inflame the thalamus, which is the pain center deep in the brain, the trigeminal nerve, it innervates the face, eyes, and jaws, and sinuses, and the cerebral arteries. These neurochemicals stay in the body 3 days, and once they inflame the brain, they're repeatedly released every time other painkillers like caffeine, Advil, Tylenol are consumed, starting a problem of continuous headache. I once saw a man in my practice who was taking 10 Excedrin migraine pills and had been doing that for 50 years. So 10 times 65 equals 650 milligrams of caffeine a day. And he had a headache all that time, every day, until I convinced him to stop Excedrin. Now, that didn't get rid of migraine, because he was born with migraine, it's genetic, but it certainly reduced his headaches, so it was livable for him. There's no data that opiate narcotics help migraine headache. They just cause problems and shouldn't be used for what used to be called rescue treatment in headache. The United States is currently going through a change in the use of opiate narcotics and barbiturate drugs, since they cause people to die in their sleep or addictive and cause medication overuse headache. Narcotics should be used only for persons who are in pain or near the end of life, for acute trauma or surgery, and only for a short period of time and then stopped. I recently heard the story of a woman who got a hip replacement. In the past, they would have given her opioid narcotics, but they gave her 1,000 milligrams of Tylenol for several days, and that was it. Death from opiate narcotics is a top problem now in America. Butalbital, which is a barbiturate drug, has been banned in every country in the world except Canada and the United States because it causes medication overuse headache. The word narcotic comes from the Greek word that means sleep. In Texas, the number one reason for the state medical board to restrict physicians concerns their use of opiate medications, and more licenses in Texas are restricted or revoked regarding this issue than any other. So those are the migraine lifestyle issues. Get off caffeine, eat regularly 3 meals a day, exercise, set your sleep pattern, deal with stress, and don't overtreat. So God bless all you migraine patients. Hope you're doing well. And end this with saying goodbye. I'll see you again on another broadcast.